Alright. Hello everybody.
Hi everyone.
This is Priscilla from Dr.K Plastic Surgery.
And this is the Dr.K, the real one. Happy Tuesday.
We want to clone him, but not yet. It's going to happen soon. My name is Lisette, and today one of our main topics is going to be brachioplasty, which is also known as the arm tuck, also liposuction, and when can a patient have brachioplasty versus liposuction.
Very good. So that's a good topic. We can talk about that, like the other things as well.
Yeah, so definitely. So we're I'm also going to be viewing live along with you guys in the audience. So if you have any questions, you can always post them up on the comment bar right under here, and yeah, we'll be able to answer them live for you guys. So.
Did you announce that we're gonna have a live surgery today?
Yes. We're gonna have a live surgery. Dr. K.
Right. We're getting close to Halloween.
Yes, we're getting really close to
live
Halloween.
Surgery.
Yeah. So the patient is getting prepped right now as we speak, and soon we'll be able to show.
Yes.
Yeah.
Very good.
Very exciting.
Okay. Where should we start?
Well, I have a question here, and the first question we're going to discuss is long-term steroid use a reason for a non-healing brachioplasty after 4 to 5 weeks?
Yes. Any other information on that question? Any other?
She says I have a history of long-term steroid use over 10 years.
Go and click. It's not iPad.
Okay.
I do that tap.
They used to do everything
I
is
do that
touch
on my computer. I'm like, tap. Why doesn't it go?
Yeah.
So this patient has been using steroids for a long time, right?
Okay.
Yes.
Okay.
She didn't mention anything about how long she's been using that.
10 years.
10 years. Oh, okay. Okay. Anything more than 6 months is enough. I mean, we called it. 6 weeks. Anything more than 6 weeks is enough that we have to consider that. So you were looking for if she has provided any other information.
My doctor believes the reason my arm lift is not healing is because of a previous steroid use.
Okay.
I had a facelift at the same time, and did not have problems healing.
No problem.
No.
Okay.
Not with the
Wow.
Okay. That's very interesting question.
Yeah.
That's yes. First of all, let's talk about that. What should we consider when the patient says he's on a steroid?
Okay.
So whoever is on a steroid more than 6 weeks the surgeon should consider that the healing might not go well the way we want it. But that was the bad news. The good news is there is a way to compensate that. The patient should go on vitamin A. Vitamin A is going to be very high concentrated dose of vitamin A. They should take it about 100,000 units of vitamin A 3 times a day, and after 2 weeks to follow with the lower dose, because we don't want to get in detail. It's not a scientific lecture or something, but it's the people that are on steroids is contradicting with something in the healing cascade that vitamin A can boost it up. So that's the whole theory about it. But going back to that lady question about had surgery on the face, didn't have any problem, and had surgery on the arm at the same time, had problem. First of all, we have to know that the arm lift, the number one problem and complaint of the people across the board in hands of all board certified plastic surgeons is the wound healing of the arm lift. Arm lift, because it's a cylinder with a short diameter, and we have to consider a lot of the calculation, but the wound problem, the healing problem of the wound is number one. However, head and neck, because she got a facelift at the same time. So the facelift, the head and neck area has a lot of blood supply. So just doing surgery on a person at the same time on the head and neck area, like facelift, and another part of the body, like hand or arm, the head and neck, the face is going to heal much better, faster compared to the other one.
Okay.
But if I were her surgeon, definitely I would put her on vitamin A with a high concentration and to boost the healing process.
Would it be possible, like maybe she didn't mention it in the beginning? Because that's something really important to mention if you're going to have the surgery, or maybe she did and just didn't know.
Yes, it's very important. Sometimes the patients forget to say. Sometimes the people they don't consider some of the medications as truly medication, like vitamins, like multivitamins, the aspirin, or the female hormone replacement therapy. If you look at this as a physiology, like it's okay. I mean, it's not, but we have to consider it as a medication.
Right. And in some cases, you can't just stop steroids, right? In certain cases, you can.
Yes.
Right. If it's not for a medical condition.
Yes, we have a good number of the transplant patients, and most of them they are on steroid because of the breast enhancement. But my advice to them, because this is not, they can medically stop that hormone replacements, I always advise them to stop 3 weeks prior to surgery. But there are some medical situations the patient cannot and shouldn't stop the steroid, like the people on lupus or other medical situation that need to be on a steroid. They should continue, but the surgeon should consider that and go with the right medications. Do the good job.
So I believe do we have any questions, or do we just want to go and
yeah, I could take some time so we can see who else is tuning in right now. We have Relentless giving us a thumbs up. We have Maria Luet saying hello. We also have Les Ibarra. We have Miss Genesis. We have a few people tuning in. We also have a Wine Country Life.
Wow, okay.
They're giving us a thumbs up. So hello, everyone.
Hello. How about a loyal follower from Chile?
Oh, we have Marisol. I think
yes. Maybe
from
she's
Chile. Yeah. So she's. We have Daniela. She's giving us a little kiss emoji with the heart.
Okay.
So sending us some love. So hello, everyone. So just be sure. Just keep commenting. Keep if you want to say where you're from. And we'll just, if you have any questions, you can just you can just comment.
Yeah, very good. By the way, you said we want to talk about the arm talk and liposuction. We didn't say anything yet. Huh?
Well, yes, like the difference, because I have a lot of patients that ask about the liposuction of the arms, but a lot of the times they think that just by having liposuction, their arms are going to look, great and tight, which is not the case. So maybe you can elaborate on that.
Okay. The most important thing in the plastic surgery, whatever we do, I would say, I'm not going to say the most important. One of the important factor in the plastic surgery is the skin and the skin situation. In any area, when I do the nose, of course it's different. The person has a different type of the skin on the nose. Anything, face, tummy tuck, breast surgery. So when it comes to the arm lift and arm contouring, the skin situation or status is very important as well. So right after examination, your surgeon can tell you, okay, you're getting a great result just with the liposuction only, or you need the arm lift. The arm lift, let me explain a little bit more. The arm lift requires a cut from here to here in most of the cases, but we have kind of the also specific time of the arm lift that we can hide the incision in the armpit area.
Right. Okay.
But it's limited cases, and the indication is limited. But when it comes to liposuction, there is no cut. Just the holes are gonna seal, and very tiny, like a pencil head.
Yeah.
So, but when it comes to the arm tuck, consider that most of the patient, again, they need liposuction as well. At the same token, they get the cut. You have to remove the extra skins, and yeah. So yes.
I think I have the perfect shirt for that.
The perfect shirt,
right?
yeah.
I knew we were going to talk about this.
So again, a lot of the discussion, debates about where to put the incision to make sure to hide it to get the best aesthetic result. One of the important factor. Actually, we started about a year ago. The arm tuck, we're doing it we use the devices to diminish the tension on the suture line. And when there is no tension, or that's the whole thing, we decrease the tension so we can get a better result, or the best results in terms of the scar. And then also the scar treatment.
Also,
To do,
yeah.
yes.
Also, when patients decide to have the tummy tuck, like he said, we would like for magic to happen and the scar to disappear within months. But patients do require a scar treatment, and some patients have even considered laser after to make sure it's gone. What would you recommend as far as laser? When can they have it after having surgery, if they're considering to do that?
Yes, if they're considering a few months after, when the incision has been healed nicely to the point they can tolerate the laser treatment, is the right time to go with the laser. You cannot start it too early, and you cannot do it very late, year from now. But by the way, how is our voice? I mean, there's no complaint about the voice is low,
How's
there's
the
no
volume?
voice is high, the volume. The last time we got a comment, oh, the volume is too low.
Can't hear anything.
So, all right.
I do want to quickly say we have Ricardo saying saying hello from Mexico City.
Hello,
So-
how are
and
you?
We have 63 Fitness from Long Island, New York, saying hello.
Great,
So
hi.
keep showing
We
up.
do
Keep
have
telling us.
patients
Yeah.
that travel from
Yes.
Oh yeah, definitely from all around. So
Yes,
That's really
very
good.
good, very good.
so what would you say is like a person that's a good candidate for brachioplasty as opposed to for the viewers out there and they're looking at their
Yes.
arms right now and they're like,
Exactly. Oh, I'm a good one.
what do I need? Yeah. So
I'm a
what
good
would you-
candidate, by the way. when we don't have the lax skin, the skin
Okay.
like there is no
Excess
skin
there.
laxity.
Got
Yes.
it. Okay.
And then there is a good skin tone. Could be a good candidate for the liposuction only.
And support garments are also a very good tool after surgery to make sure that the skin retracts, and
Yes.
that's going to make a big difference.
Yes.
How long
Definitely.
would you recommend
The garment, the first
Uh-huh.
garment, I usually recommend 6 weeks minimum. I tell them that 3 weeks, make sure to wear it 24/7, but of course it's impossible. You don't want to take
So
a
I'm
shower, you have to
guilty?
do that.
So I'm guilty about telling patients to wear it for 3 months. I'm like, no, use
No.
it as long as possible, for
Yeah.
6 months if possible.
Or
Yes,
more.
I tell them 6 weeks is good enough for me, but after 6 weeks, I can say 85%.
I always try to push
the,
patients.
yes, I tell them you
I
pay
mean,
for the
it's
garment
better,
there,
yeah,
yes, to use
might
it.
as well just use it.
Doesn't hurt. At least after the 6 weeks, they cannot give themselves, or
Right.
you cannot give
Give
them
them a
any
realistic.
guilty guilt trip. Yeah, why
answer.
didn't you wear it? Yes. Yeah. 6 weeks is a good one.
So I think right now would be like the perfect time because it's getting the cold weather. It's easier
Yeah.
to hide. You're
Oh,
not dealing
yes.
with the summer. Where
Oh
it's
my
like,
Exactly.
God, yes.
Exactly.
So
People still have, they still have surgery during the summer, but that's the biggest question. Do I have to wear
Yeah.
this during the summer?
Very good.
perfect.
So you think your patient is getting ready?
Yeah, we can
Yes,
we
prep.
can check. Do we have time? Yeah.
Time
Very
to
good.
answer any
Okay.
questions?
All right.
or-
So I'm gonna go in there, get pretty much the patient
Okay.
in the room. We're gonna get them
Call
prepped
her
right
ready
now.
to
Well,
do
It's
that.
already prepped, so
We continue.
Let's
Yes.
talk about our walk on Saturday.
All right.
This Saturday, the
Yeah,
13th.
it's this Saturday.
Let's register at 8 a.m. and walk starts at 9 a.m. So it's very exciting for patients who want to donate $50. You get $500 credit to have surgery with Dr. K.
Yes,
So-
that's a good thing.
Yes. Also, you're going to get a T-shirt.
Oh, it has a great quality. I tried that. I love
Very
that.
soft.
Oh, it's very soft. Yeah.
So if you don't do
Each
it
year
for the
getting better.
surgery, do it for the T-shirt.
Yes, we can do it for t-shirt. Oh, on the back as well. So
Yes.
even guys, you can come. That's not bad. It's pink. I know we have something, but it's
A
doable.
lot of guys are into wearing pink now.
Yes.
So, okay, so let's go and get you prepped for surgery.
All right. So we gonna go, and I'm gonna start the live surgery. Stay tuned. Don't go anywhere. Ready?
yes, we
Okay.
are ready. So
Let's do it. Let's do it. We cannot keep the patient waiting.
no, we
All
cannot.
right. All right.
camera's gonna be falling.
Yes, the camera's
Like, what's
gonna be
going on right now? Now this is very exciting because this is like the first time we've ever done this, and the patient consented and everything. So Dr. K is getting prepped right now.
Yes.
All right.
Patient's under anesthesia, so you
Yes.
can make noise.
Is that good?
Yeah, that's
yes,
fine.
that's good. How about this?
Okay. First time you're operating in your regular load beam
Yes.
with a tie and everything.
This is good. You have some skillish, yes?
Yeah.
So,
In this case, it's under local and oral sedation, correct, doctor?
yes, yes.
Okay.
So, alright, how are you?
Let me know if you need anything, doctor.
I will. It's very sensitive.
Let me go ahead and take that.
There you go. Uh-huh.
Yeah, he needs everything.
Yes.
Oh wow! Look at all
Liposuction.
those.
I want to make sure nothing goes wrong.
Yes.
Yeah, otherwise I'm gonna get the buzz. I'm gonna be the first pieces out.
All right.
Yes, you have to. Spaceman.
There
Send
you
it for
go.
pathology.
We're gonna send them.
Alright. Yeah, not the piece coming out. See?
You're doing so good.
Yeah,
He
yeah,
has
yeah.
so much practice.
Yes, you know, you're doing very well. No, let's go for the easy one to fish.
The wishbone.
Wow.
Yeah. Maybe I have to injure the
100%
patient.
so far.
Yeah, so far. This is not easy.
So it's really close to the neck there.
Yeah.
Alright.
Another one. Oh my god. A lot of it. Yeah.
Oh, you're
What's this
good.
one?
No.
Let me do some chili.
No.
Okay. Yes. Oh!
Game over.
Over.
I'm pretty
Alright.
sure we got a few things in there. Well, that
Thank
was
you.
very
Thank you
exciting.
for being with us.
Yes, and the patient as well for consenting and everything,
Yeah.
for letting us be bring everyone here into
Yes.
the surgery room. All right.
Yeah, again, that's not the real surgery room.
No, of course not. No.
Don't get us
We
scared.
have an accredited facility.
Yes.
Yeah.
And so we look forward to seeing you with us next week, next Tuesday,
How
same
about
time.
Saturday?
Saturday.
Yeah,
Yeah,
Saturday.
looking forward to
So
see
this
you.
Saturday, did
So
you
what?
show them the Dr.K t-shirt?
Yes,
Everyone?
yes,
Yeah,
yes.
so stay tuned.
Yeah.
We also have a couple of the little gifts for the people that are going to be participating. So if you have any questions or you want to message us, go ahead and do so. And it's not too late. If you haven't signed up already, it's not too late.
All right.
Thank you.
Thank you. Next
I
time.
hope you had fun.
Yes.